Hi friend, this is Dr. Magarana from Magarana. Welcome to my YouTube channel. And today's our topic is types of diabetes mellitus. So let's get started. There are mainly two types of diabetes mellitus: type 1 diabetes mellitus and type 2 diabetes mellitus. This is type 1 diabetes mellitus and this is type 2 diabetes mellitus. Type 1 diabetes mellitus is mostly occur in 10% of cases. 10% of cases, and it is mostly occur in children. Therefore, it is also called as juvenile onset diabetes mellitus. And it is the another name for juvenile diabetes mellitus or type 1 diabetes mellitus is insulin dependent diabetes mellitus, because the only treatment of type 1 diabetes mellitus is the insulin. There is no tablet available for insulin. Insulin is available only in the injectable form, and every meal, whenever the person who have the type 1 diabetes mellitus, he has to take the insulin injection. If the person is taking meal for twice, then the injection should be given before meal for twice. Type 2 diabetes mellitus, it is occurring 90% of the cases are the type 2 diabetes. It is most common type 2 diabetes mellitus is the most common. It is mostly occur in adult or older age. That's why it is also called as maturity onset diabetes mellitus. And it is the another name for type 2 diabetes mellitus is the non-insulin dependent diabetes mellitus. But it is actually a misnomer. Looking at the name, we can think that insulin is not required for the type 2 diabetes mellitus. But initial stage, first of all, when the person have type 2 diabetes mellitus, he has to restrict the diet, that is taking low sugar diet, lifestyle modifications, taking regular exercise. After that, the sugar will not be controlled. After that, if the sugar will not be controlled, then insulin is given. Insulin is given. That means it also requires insulin, but at the last resort. Insulin is the last choice of treatment for type 2 diabetes mellitus. So it is a misnomer. Insulin dependent diabetes mellitus. It is non-insulin dependent diabetes mellitus. And type 2 diabetes mellitus occur mostly in old age. And type 1 diabetes occur in children. And most common type of diabetes mellitus is the type 2 diabetes mellitus. If you remember the type 1 diabetes mellitus, the remembering the type 2 diabetes mellitus is easier for you. So you just remember the type 1 diabetes mellitus. And exact opposite is the type 2 diabetes mellitus. Let's look at the risk factor for diabetes mellitus. First is the family history. If the person have mother and father diagnosed with diabetes mellitus but type 2 diabetes mellitus, then that person in future also have type 2 diabetes mellitus. If he do regular exercise, diet restrictions, taking low sugar diet and lifestyle modifications, then he can postpone his type 2 diabetes mellitus. But in the older age, he definitely have the diabetes mellitus. So we can postpone it by lifestyle modifications and physical exercise. Second risk factor is the history of gestational diabetes mellitus. If a female is pregnant, during pregnancy, if she diagnosed as diabetes mellitus or increased blood glucose level, or after delivery she become normal, that is euglycemic, because her sugar level become normal in the normal range. But after some time or in old age, she might have type 2 diabetes mellitus. Type 2 diabetes mellitus. History of vascular diseases like hypertension, thrombophlebitis, arteriosclerosis, atherosclerosis. If the person have, then it may lead to diabetes mellitus. Hypertension is also a risk factor for diabetes mellitus. PCOD is again a risk factor for diabetes mellitus. Obesity leads to type 2 diabetes mellitus. Obesity leads to type 2 diabetes mellitus. Habitual physical inactivity. If the person have physical inactivity or sedentary lifestyle, sedentary lifestyle. Dyslipidemia, that means HDL, high density lipoprotein, is less, that is 30 milligram per deciliter, below 30 milligram per deciliter. It is a HDL is a good cholesterol but occur in less amount in the blood. Emia means in the blood. This means abnormal level of lipid in the blood. It is again a risk factor for diabetes. It is again a risk factor for diabetes mellitus. HDL is high density lipoprotein is less than LDL. LDL is a low density lipoprotein which is bad cholesterol. If lipoprotein, low density lipoprotein is more than 250 milligram per deciliter, it will lead to diabetes mellitus. Race and ethnicity. In black persons, diabetes, the chances of having diabetes mellitus are more. In Asian peoples, Asia, Pacific Islanders, it is again related to race and ethnicity. Thank you.